So, feel for tendon. Okay, so palpation is massive as well in terms of tendon. I had one guy that had a tear in his tendon, and he had a 7mm tear. And he had 2 PRP injections. PRP is basically what to do now is it's getting very celebrity type scenario where you take blood from the person, you spin the blood in a centrifuge, and then to take out the plasma and direct it straight into the injured site. So injecting their own blood back into it, trying to create a healing response by having more blood in that area. Costs about €800 injection, quite expensive, and it doesn't work. Doesn't work. So unless it's a very acute injury that you can get in, but most times you're not going to get with a patellar tear that you're going to catch Steve because you're going to end up staying doing training on it, or eventually just I can't play, and then you get an MRI and there's a 7mm tear. So you know, your eccentrics might work in that case, might not, because 7mm is quite a significant tear. But anyone that has patellar tendinopathy, we tend to use this tape and technique just to offload them. Now, and as I think Ben said, we need to look at what overload, and this is how we. Veron was probably the guy that you'll actually see here, always wearing this. So spin it around, and then we put it around again. That's it. So it looks as if you just have white tape around your knee, but it's the spinning on it that gives that tension to offload the tension off here as well. So you turn the tape, bang, and you go in. Is there foam roll, or sorry, underwrap there? Is there any underwrap in that? This is how girls in America used to do it, and they came up with their own way, because some people didn't like this. Now some people don't like this one either, so just have a nice little flex, and you just get a load of the girls are doing this a lot easier. Yeah. So what to do is roll it up and then curl one underneath the other. And that's it. That should be a little bit higher up in the tendon. Just smack on the tendon. So if you ever see a patellar tendon strap, it looks something similar like that. And you buy €15. Do it with foam or underwrap. So I tend to prefer this one. This one can get quite tight and quite uncomfortable, but that wants to be up a little bit higher just on the tendon, and to roll it up. David's hairs won't allow us to do that. There you go. That's another way you can do for patellar tendinopathy. But nobody's mentioned what would be the biggest loading of the patellar tendon. So we talked about overtraining, talked about tightness of the quads. What would you think is the biggest issue? Fracture. Obviously, you could have a fracture, and you might need to rule out that with an X-ray. Yeah. That's what's going to give us obviously the overload. But why would it be the tendon having to work eccentrically, or why would
the size of the patella itself be involved?
It can, because there is conditions patella alta, patella baja, in terms of the length of the tendon. Not so much weak hamstrings, but you're kind of trying not to think of just muscles or anything. What would?
Q angle.
You're not so much Q angle, but you're getting there.
Position of the hip, internal, external rotation of the hip, too much.
Yeah, so what do we call that in terms of overall? When we look at the whole position in the lower leg, what are we looking at?
Biomechanics.
Biomechanics, exactly. So it could be the biomechanics in terms of how they're jumping, how they're landing, is there internal rotation going on, that they're loading, is the knee flexed, that they're loading that tendon way too much. And a good example of that would be, I was treating a patellar tendinopathy in a young guy. No, definitely wasn't Oscar Slatters. That's something you need to rule out as well, that it's not palpating on the tendon or the bone or on the pro plate. So it was definite tendinopathy. So I was there treating away, and I kind of he was a kickboxer. So I was there going, right, okay. And it only happens when he's sore after training. You know, So I said, right, okay, no pain going up and down the stairs. No, not really. He says, just constant after training. So typical tendon pattern, you know, warm up, got stiff going, but once he trained, no problem, just very sore afterwards. So I was saying, right, give us a look at your, now I'm no martial artist, and give us a look at your kickbox. And this is what he was doing. So as I said, kickbox is all about knees in, and literally this is the way he was doing. He was like that. He was leaning back, so all the pressure was going down through that mechanical on the knee. Instead of, I would imagine, getting in, you have to get in as tight as possible, bang, into the knee, rather than loading that and then kneeling back, that he was forcing all that leg, taking the load, because it was only on the standing leg that he had the patellar tendon. So sometimes you need to look at, and obviously software is quite good on phones now, we all have smartphones or tablets. So you have Coach's Eye is a nice little software that you can use in angles, show people back. You have Uberson is a new, you know, Android version after coming out in Uberson. So these are all, you know, use and show clients their mechanical advantage. If they're there and they're squatting and they're doing loading knee and collapsing in, use it, show them, because they need that feedback loop as well. So that's for patellar tendinopathy. What do